Dr. Deepa Patil from Department of Oral Medicine and Radiology. The topic of her talk is comparison of serum and salivary vitamin D levels in patients with oral potentially malignant disorders and oral squamous cell carcinoma. Over to you, ma'am.
Thank you. Good evening, one and all. I'm very glad to be part of this prestigious conference and presenting my research. We all know the prevalence of oral carcinoma is very high. Slide. Yeah. And I am basically a oral medicine specialist. We are oral physicians from the dental fraternity. And day to day we see many patients of oral cancer. But there is something called as oral potentially malignant disorders. These disorders are one which are occurring before the occurrence of malignancy. So in that we have OSMF, leukoplakia, and when we have oral cancer. We have done this study in this group of patients. So we as all know, like oral cancer is very prevalent too much globally, and sixth most cancer in India. And every day, there are 77,000 new cases reported and 52,000 deaths annually. So about 1/4 of the global incidence of oral cancer is in India. And most of them, unfortunately, report to the stage 3 and stage 4 stages. And the 5-year survival rate is only 20%. So what could be the reason? One of the factor is they are mainly occurring in people who are consuming habits, tobacco use, and they are not, exposed to early detection. And most of them report to us when they have a big growth in the oral cavity or they have mobility of teeth. So the incidence is very high when they come to us in stage 3 or stage 4, when it is only in the operable or in the palliative stage. Now this was what I was talking about, are the oral submucous fibrosis, leukoplakia. Now oral submucous fibrosis is very common. I am coming from Gujarat. So there the habit of gutka, arecanut and a mixture of tobacco is very high. It's rampant. So oral, every day we have nearly, many cases of OSMF varying from stage 1 to stage 4. So they have reduced mouth opening. Gradually the mouth opening reduces, and then in the posterior part of the oral cavity, then there is a transformation into malignancy. And leukoplakia is presentable as a white or a red patch. It's a raised plaque. So and then it goes transformation into malignancy, like into a ulcerative growth. So now overall in India, the prevalence of all these oral potentially malignant disorders is high, be it be north, east, west or south. Everywhere, due to the habit of gutka, especially the pan masala, tobacco and arecanut mixture, the prevalence is very high. So when we see the IRC or the Globocan data for 2020, so there is a high incidence of malignancy or lip oral cavity cancer at the third rating, as well as in both, and it is supposed to be having increasing mortality also, and most of them are associated with tobacco use and also due to alcohol. And the risk factors most commonly are associated are tobacco. 49% is due to the use of tobacco. And when we see that in the further in the future, from now 2004 to 45, the incidence is going to rise and the mortality is also going to increase. So what we all know, that there is a multi-step carcinogenesis model from initiation to promotion to metastasis. So we require that the translation oncology says that we should have some markers which are there, which are easily identifiable and can be used in these patients. So we have a big list of markers which are there, from chair side to histopath to imaging, but most of them are not feasible everywhere and not affordable. So now one which is there everywhere. Now vitamin D is one which is commonly discussed not only in endocrine disorders or calcium metabolic disorders, but it is very highly talked about in the oral cancer also, like not much in oral cancer but in other colorectal or pancreatic cancers. So what does vitamin D do? Now vitamin D has got an anti-cancer effect. It has an anti-proliferative, it helps in decreasing the differentiation, anti-inflammatory by decreasing the pro-inflammatory cytokines, and main common is the apoptosis induction by suppressing BCL2 and promoting anti-apoptotic genes, and helps in reducing the metastasis by suppressing the MMPs and also by suppressing the vascular endothelial growth factor. So, and why oral cancer is being a topic of interest, because many cell line studies have been done and in vitro studies where it has got differentiation of the keratinocytes, which are the cells of the oral epithelium. So it helps in the, so it is hypothesized that it will help in the development of oral cell squamous cell carcinoma. So now previously many studies have been done globally where vitamin D deficiency has been observed in lymphomas, lung cancers, breast cancers, prostate and colorectal cancers and ovarian cancers. So with this background, there were no studies done uh, much in India and in our part of Gujarat, where we have done in pre-malignant lesions. Nobody has assumed the vitamin D levels. So the main objective was to assess the serum and salivary levels in these all pre-malignant lesions as well as in oral cancer, and also use saliva as one more medium because blood is invasive. So whether we could correlate the saliva and the serum levels. So this was a cross-sectional study actually funded by ICMR also, this thing, and with the help of a central research laboratory. What we did was all clinically and histopathologically proven cases of OSMF, leukoplakia and oral cancer were selected after a stringent inclusion criteria, and all metabolic, endocrine and systemic disorders were excluded, and we collected the serum and saliva in these patients. These are our, the first slide. This is a leukoplakic patch, which is a white plaque, and these are the OSMF stages where gradually the mouth opening reduces, and this is a oral, as a vegetative ulceroproliferative growth. So these were included after histopathology. So, and with the help of chemiluminescence assay, vitamin D was determined in both serum and saliva, and then these are the normal levels. And so when there is insufficiency, it is what, 29 to 10, deficiency is less than 10, and severe deficiency is less than 7. So now, because of the limited funding and all, we have included, and the duration was also short. So we have included 60, so 15 in each group, 15 OSMF, leukoplakia and 15 oral cancer patients were used. And they were, like the mean age was around 40 years, and most of them were the male genders. And the habit most commonly seen in all the groups was the association of tobacco and arecanut. And the mean age was around 40, 46 and 50 in all the groups. And the gender, it was more commonly the male genders were there, and the mean serum and the salivary levels, as we can see here, the serum levels were around 20, 24, and in oral cancer it was more lesser, it was around 18, and it was all comparable in the saliva also. So, and most, after testing the normality and the post hoc analysis was done, we found that within the group there was no much of difference, but when we compared OSMF with controls or leukoplakia with controls, there was significant disturbance in the difference. It was statistically significant for both the serum as well as the saliva. It was and a good correlation was seen between the serum and the saliva. 0.7 correlation was seen. So now this was a first study to assess the serum and salivary levels in all these patients, and we got a good correlation. And patients had lower levels of serum and salivary vitamin D, and both insufficiency and deficiency. And deficiency was seen in oral cancer groups, and it was more pronounced in the oral squamous cell carcinoma. So what could be the reason is that now vitamin D acts at several levels. Though the more major drawback in our studies, we have not done any genetic regulation. That is our further study we have applied for grant, where we can elucidate the vitamin D receptor from the oral tissue, and we check the expression of vitamin D receptor. So the role of vitamin D is that it says that vitamin D helps in decreasing the apoptosis by suppression of the pro-apoptotic genes like BCL2, and decreasing the vascular endothelial growth factor, then suppressing the cytokines, and also decreasing the cyclin dependent kinases, which help in the proliferation of the oral cancer cells. So, and one more thing is, now what has to do, because now vitamin D is deficiency is prevalent, it is very difficult to localize it to only these patients. Now what this, because tobacco and vitamin D, they go hand in hand, what it says is that the vitamin D receptor, which is there, it decreases the oxidative stress. Okay, so by by suppressing the SOD and glutathione peroxidase. But when it is consuming the tobacco, the which is causing the free radical damage, the vitamin D action which is there, it is suppressed. So this is how synergistically the tobacco use can help in decreasing the efficacy of vitamin D and developing these oral lesions. So it is said that this is a pictorial diagram which shows that vitamin D, because of the carcinogens which are present, which are there in cadmium and lead, so they all the red arrows show how the vitamin D is increased, and even though intake is there from the diet or from the sunlight. So now previously studies have been done in the literature. Now this is one systematic review which was done. Like vitamin D has interested many researchers worldwide in oral carcinoma, where many case control and cohort studies and clinical trials have been done, where they have told that vitamin D deficiency is prevalent in oral cancer patients. So and there are two studies where they have used vitamin D as a drug therapy in patients who are undergoing chemotherapy. Now, one more interesting thing is that it may not be very useful maybe initially, but patients who are undergoing chemotherapy, what happens is their vitamin D level is decreased. So whatever cytotoxic side effects which are there due to chemotherapy because of the cisplatin use can be mitigated or reduced by vitamin D, and this has been proven by two studies by Bochen et al. And Anand et al. So they have told, and Bochen et al. Has showed that the cytotoxic activity of the natural killer cells has been suppressed by vitamin D supplementation. So by Anand et al. They have studied that hypovitaminosis or decreased level of vitamin D, it reduces the survival rate. So when we give vitamin D in patients who are undergoing chemotherapy, it can increase the quality of life and also decrease the side effects of chemotherapy. So this is our first study. It is like a pilot study which will help to regulate the level of vitamin D insufficiency which are there, and we also got good correlation between serum and saliva. One potential limitation was a small sample size, and we have not assessed other confounding factors like their duration of exposure to sunlight or their BMI and lifestyle and other food related habits. So in future we intend to conduct a well designed cohort and a trial where we are going to use vitamin D in both these oral pre-cancer and cancer chemotherapy patients to know the proper effects of vitamin D, so that it can be used as a epigenetic therapy both pre-cancer and oral cancer patients. So I just want to say that as whatever we give, whatever normal empirical therapy we give for our patients, also vitamin D should be added as a adjuvant therapy, so that any side effects and more better healing and chemo prevention activity of other drugs can be used. Thank you. These are my references.